Hello, everyone, and welcome to another Power Panel. Before we get started, I wanted to mention that today's Power Panel is brought to you by MYOS MD, the cutting-edge nutritional supplement designed to combat muscle loss and support healthier aging. Powered by Fortetropin, a natural bioactive compound clinically shown to enhance muscle growth and reduce anabolic resistance, MYOS MD is changing the way we think about muscle health. If you'd like to learn more, you can go to myosmd.com. All right, well, getting to today's guest, we have Dr. Mark Tager. Let's just jump right in. Can you tell us a little bit about your clinical background?
Well, I like to describe myself as a recovering family physician who has a split personality disorder. Usually, the family physicians get a chuckle out of that because it's a pretty hard time to be a physician these days, I think. And the split personality really has to do with the fact that about half of my life has been in integrative functional medicine and the other half in aesthetics. So I started out very early on as a functional medicine, integrative medicine physician. My clinical path went up through Kaiser Permanente, where I saw patients there, but I also directed health promotion for the Northwest organization. And then I started writing and teaching and training other physicians. And then in year 2000, we started the Fraxel laser, the development of that. So, a lot of my work now centers on this concept of integrative aesthetics, how we need to have beauty from outside in and inside out.
Amazing. And today I want to talk about the vagus nerve. So you often speak about the vagus nerve as the master regulator of health. Can you start by explaining what it is and how it plays a central role in stress regulation and inflammation?
Sure. By the way, for those of you who want to learn more, I co-founded the Vagus Nerve Society with my colleague, Dr. Peter Stotz. And we're in 82 countries. We've got a certification and training course. We have thousands of practitioners from every walk of life. But I've always been interested in how we can harness the power of the parasympathetic nervous system. So if you think about the vagus nerve, we all learned about it in our training in medical school. It's the wanderer. It's the longest nerve in the body. And it hits just about every organ. And it is really responsible for rest, restore, relax. And we've got this balance that we're always trying to work on between excited and relaxed. So this is the master regulator of peace in the body. And I think it's most important today because we see so many patients who are wired and tired. And this wired and tired, this sympathetic overdrive contributes to exacerbate so many of the conditions that we see today. So again, it goes down through the brainstem, it goes into the vocal cords where it's responsible for phonation, is responsible for the regular peristalsis of the GI tract, for gastric emptying. It goes down into the heart where it slows heart rate, the lungs where it dilates blood vessels. And then really, if you think about it, 80% of this organ is afferent. 20% is efferent. So 80% of the fibers are sending information up to the brain. And the biggest part of that has to do with the GI tract, in which the gut is constantly sending information back up to the brain. So that's where the gut-brain axis plays in.
Great. And let's talk a little bit more about how vagal tone influences the body's ability to control inflammation. Why is this so important for healthy aging?
Yeah, this is an absolutely fascinating area, and it's driven by the work of Dr. Kevin Tracy, who really talked about and discovered the inflammatory reflex. And what this is, if you think again that we've got 80% of this or of the nerve sensing the environment, and it's sensing the presence of chemokines and cytokines and hormones and these bacterial fragments. And it's taking that information and sending that up. For example, let's say we've got an inflammatory response happening with TNF alpha and interleukin 6. We've got that information going up via the vagal efferents to the brain, and from the brain down via the vagus nerve to the spleen, to the gut. And there, what it does is it dampens the mast cell response to inflammation. And it does this, interestingly enough, through a receptor called the 7-acetyl-nicotinic acetylcholine receptor. Big word, but those are the receptors, and this is interesting, both on the nerves, but they're also found on the membranes of mitochondria. So this unlocks the door both to inflammation, but also metabolism. And certainly if that fits into the scheme of muscles and metabolism and mitochondrial activation. So now, what's really interesting is this is how does curcumin work? We know it's been around forever, turmeric as an anti-inflammatory. How does ginger work as an anti-inflammatory? How do the omega-3 fatty acids work? They work via this inflammatory reflex. They work by signaling the afferent fibers of the vagus nerve and triggering this inflammatory reflex.
Great. And going beyond inflammation, what are some of the lesser known ways that the vagal tone impacts metabolic function? You started talking about that a little bit, as well as immunity and its resilience.
Yeah, so we see this direct connection with mitochondria, and I think if there's anything that's really on the radar today, that's really exciting, it has to do with mitochondrial activation. How do we upregulate the ATP production in the body? So often now we focus on all these GLP-1s, and which actually slow down vagal, which affect the vagus and slow down. They can create gastroparesis by slowing gastric emptying. And so we need to counter that. So the vagus nerve can help counter that as well. So we see this throughout metabolism and muscles. The connections are not as strong as in other areas, but certainly it plays a role with immune function and immune health as well.
From a clinical standpoint, how can healthcare providers assess vagal tone in their patients now that they know, what the vagus nerve is and how it can actually be so instrumental in inflammation and stress?
Well, our surrogate marker has always been heart rate variability.
Oh.
And if that's the surrogate marker for vagal tone, and there are hundreds and hundreds and thousands of studies connecting behavior and stress and food and diet to my favorite supplement, which is cacao, and even cacao, good dark chocolate will increase vagal tone via this heart rate variability. So for those folks who are not familiar with that, you would think that a good thing is that each heartbeat be regular, 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 regular. But that's not the case. There are minute differences in the beat to beat interval. And the more diversity you have in that beat to beat interval, the more variability you have. There are thousands of studies linking that to better health outcomes, less disease, et cetera. So that is essentially the marker. Now, we can see that on an EKG. We can see that on a Fitbit. We see this on many of the devices that people can use. So these are really good surrogate markers, and that's when you're getting a reading. What they're doing essentially for heart health is heart rate variability. So there are so many things, and again, my favorite. I will have to give you my favorite study. It has to do with taking college kids and giving 10 grams of white chocolate or 10 grams of really serious dark cacao. And the ones who had the dark cacao had the increase in their heart rate variability, and those who had the white chocolate didn't. So it's 10 grams though, so that's a good slug. But 3 o'clock every day, that's what I do. I get my little slug of cacao.
That's amazing. And let's say that's your number one favorite. What are some of your other, let's say the top 5 favorites to improve heart rate variability?
Number one is deep breathing. And
Okay.
deep breathing. So what happens is when you start stretching the receptors in the lung and you get this deep belly breathing, you are sending, again, signals are going up to the vagus nerve and coming back down to regulate and slow heart rate. Now, those are usually what's called the C fibers. Not all the fibers of the vagus are the same. There are smaller fibers, there are fibers that are myelinated. It's the larger ones, the C fibers, that go to the heart. And so we start slowing heart rate. So, and I know this is kind of a little off because probably the best thing you can ever do with your patient is sit down and teach them to do deep belly breathing if you really want to help them with vagal tone. And it's a really nice ritual when you'll have a patient come in who'll be wired and tired and unfocused, to say, let's take the next couple of minutes. I want to show you an exercise that you can do anytime, and you will feel the peace and the restoration and the relaxation go through your body. Now, I like and practice routinely the 4-7-8 breathing. So deep belly breathing, in for a count of 4, hold for 7, out through the mouth for 8. And if you do that 2 or just 3 times, it takes a minute, everyone will feel a deepened sense of relaxation and peace. And if you hook them up to an EKG or you monitor the heart rate, you will find that it slows. Also, blood pressure goes down. So this is a really great practice to give people. Now, what's another one you're going to ask?
Mm-hmm.
Cold plunges have become very trendy. And how do they work? Why do they work? They work on something called the mammalian diving reflex. So about 25 billion years ago, the forerunners of the sea-based mammals were on land and they returned to the water 25 billion years ago. They were being chased and they said, well, maybe the water is a safer place, into the water. Now, what had happened? Their respiration had to dramatically slow. Their blood needed to be shunted to the major organs. Their heart rate needed to slow down. And what we know actually is, you very often don't have the luxury of, I'm really stressed, I'm going to go home now and jump into a cold plunge. What you can do is you can immerse your face in cold water, because the major afferent nerves that control the mammalian diving reflex are all wired around your nose and mouth and your face. So just plunging your face into cold water will set off that response as well. And of course, there are other benefits, musculoskeletal benefits to cold plunges. Obviously, athletes do this to regulate inflammation after games, etc. So you'll always find them in the cold pools.
Yes, definitely. And I wanted to ask, given the information you provided so far, it sounds like chronic stress and poor vagal tone can probably accelerate aging. So can you talk a little bit about that and how these processes impact physical health outcomes over time?
My colleague Peter Stotz has actually filed a patent on some work he's doing around telomeres. And if you think about telomeres having a finite number of divisions, I always think of these like they're the end caps, obviously, of our chromosomes, and they divide each time, and then they shorten. And I always think of this as a New York deli sort of thing of slicing the salami. Are you taking a big slice? Are you taking a thin slice? And you want to take thin slices. You want to slow down that process. So we believe that in addition to the metabolic changes and the changes around reducing inflammation, obviously, which is a big one. There is a connection to telomere length and telomerase that may also exist as well. Now, this needs further research, but there's so many things. The work of Elizabeth Blackburn, documented that there are many, many things that go into accelerating telomere loss, telomere shortening. So we believe that there's a component of that is vagus nerve mediated. There are two ways we could look at this, Swati. We could say, let's dive into this from a deep scientific viewpoint and see if we can find all the factors. Or we can look at this on a whole person, holistic perspective, in which we just say, the human body was not meant to be on 24/7. It was meant to relax, restore, digest, recover most of the time, and every so often to have those bursts. But today we're tired, and so I think the vagal nerve stimulation as a practice, and there's many ways to do it. Obviously, deep breathing, meditation, yoga, all involve this whole person approach. And then there are stimulators that take into account electricity and the importance of the ease of electricity. Now, how do we know this? 1997, the FDA cleared for approval for childhood epilepsy vagus nerve implanters. So you could implant a stimulator into the vagus nerve and use that to control epilepsy. Now, the device is not on all the time. It's a duty cycle. It's on, let's say, 5 or 6% of the time in bursts. So we know there's very good, robust data looking at implantable vagus nerve stimulators for a number of diseases, but certainly it's been used very successfully in epilepsy. Now, what we started to find out was that, there are other branches of the vagus nerve that we can harness. The major one is right here up against the carotid. It's in the neck, where you got the entire vagus nerve, the major pipeline to the body. There's also this little small branch around the ear, on the auricular. That's all. And so if we think about that, gargling, singing loud, pulling the ear, those all stimulate small branches of the vagus nerve. But now we have the opportunity to use electrical devices, both at the ear and the neck, to stimulate the vagus nerve and to reset this parasympathetic system, to give it more tone, more balance. And that brings about many of these physiological changes.
And on the note of whole person health, how can sleep improve vagal tone, or can it?
Yeah, sleep is the universal healer. Again, if you look at heart rate variability, and we go back and we see people who get good restful sleep versus people who have interrupted and shortened sleep, we will see changes in heart rate variability. So we can again assume, since that's a surrogate marker, that that's critical and important. And I like to think that there's so many. My favorite image is the nighttime gardeners, because I'm a gardener, and I go out and I weed and I prune and I cut back and I pull off the dead leaves and the stems and some of the fruit that I know is not going to make it. And when you think about sleep really is the time when they're pruning dead cells and cells that in little fragments. So there's a restorative process that takes place there. How extensively that's linked to the vagus nerve, not really sure. I think it plays a role. And we also know that there are some studies looking at some of the neurological issues. Now, certainly anxiety and depression. There's some FDA cleared devices, an auricular for anxiety and depression, I think. And we know that if you take thousands of people and have them do vagus nerve stimulation, they will report that their anxiety has dropped. It has been these devices have been used for PTSD. They are being used for Parkinson's, interestingly enough. Not that it's a cure for Parkinson's, but there's some good studies coming out of the UK looking at balance and stride and gait. Can we maintain and help improve gait in Parkinson's, which is really important. So, we are just at the forefront of a lot of exploration of vagus nerve stimulation for mental health issues, for metabolic issues, for general wellness, for sleep. Now, one of the things I can tell you is that people who use a non-invasive vagus nerve stimulator, certainly the ones at the neck, report one of the number one thing they report is they sleep better. And that makes an enormous sense. To use this before bedtime, other things, obviously, there's melatonin, and you want to get your progesterone levels right if you're a woman, essentially. And there's other herbs that you can rely on. But this vagus nerve stimulation in several minutes really puts the body in that great state for sleep.
Yes, definitely. And as we talk about, the vagus nerve and vagal function in general, how can personalized nutrition influence it and, neuroregulation in general?
Yeah. So, I have a book called Feed Your Skin Right, and it's all about personalized nutrition. And, when I approach the personalized nutrition, I try to approach it from the skin. Now, why do I approach it from the skin? Because the same person who has concerns about spending $35 or $50 for a copay also spends $3,000 on Botox and fillers and facials and so and so. So, and the skin, obviously, 5 to 8% of the blood flow is going through the skin every time our heart beats. So it's really the perfect endpoint. I mean, we certainly see, when people get on the right personalized nutrition program, their skin improves. I mean, you just see that all the time. So, but that process is one of finding out individuality. Now, for me, this involves a test like Spotlight on Skin from Designs for Health, and what that does is looks at SNPs, the SNPs that relate to both nutrient inefficiencies or deficiencies, but also physiological processes. So there are SNPs for MMPs that break down collagen. Some people have more than others. There's SNPs for glycation. There's SNPs for ROS, reactive oxidative species. So we have all of these SNPs, and what we can do is create a personalized program. Now, add to that, add some basic microbiome testing, which can help us understand more about diversity. You want a very diverse microbiome. You want to look for dysbiosis. You want to begin to move people towards more cruciferous vegetables and fiber and fermented foods. So we begin to heal the gut that way. We can learn a lot about leaky gut through tests such as zonulin, either blood or stool, or some of the other tests where you will pick up that. There are now tests for mitochondrial efficiency, mitochondrial effectiveness. There's an interesting test. And certainly what we're learning now also, and I think this fits right into what MYOS is doing, the emphasis is moving to muscles. How do we maintain? How do we strengthen? And we're learning more about these myokines and how they affect the brain. That I think is just absolutely fascinating. I know David Perlmutter speaks to that very often. I think that's a fascinating subject. And who you have to thank? You have to thank Ozempic. Because now with all of these people losing significant amounts of weight, the focus is shifted. The focus has shifted to, okay, you're losing weight. How do you keep your muscles stronger? How do you maintain muscle mass? And then layer on top of that, in my age demographic, sarcopenia, which is how do you slow down the rate of muscle decline, muscle loss, lean muscle mass loss with aging? So I think all of those play a role. And I think the vagus nerve is sort of, you've got all this at top, and it's running beneath as a way to decrease inflammation, to make sure those mitochondria are the membrane receptors are being affected properly. It's helping to slow down the rate of consumption, of burning, of energy that's being wasted in many ways. So I think we talk about holism, and we talk about this concept of synergy. And I love this word synergy. When I think about what is it that I would do with a patient, I've got to get the vagus nerve, and I've got to get their diet, and I've got to get them moving, and I got to get them sleeping. And very often, people come to clinicians, certainly functional medicine clinicians, at points in their lives when they're at a crossroads, or they've experienced something, or there's something happened, something has triggered them to investigate their health and well-being. And, I think this concept of functional medicine, integrative health, is where you give people the gift of time, first of all. And that's TIME. I mean, you can give them time and rosemary and sage also, but the ability to sit down and listen and focus. It's one of my favorite things about the vagus nerve has to do with actually this concept of coherence or resonance. So we've known for a long time that you could pick up the rays from the heart with electromagnetometers 3 feet from the body. So when you've got two people who are 6 feet apart, the energy, the electromagnetic energy from their hearts are touching. And, when you get into a more parasympathetic tone, and you are breathing, and let's say you as a clinician are breathing, and you are centered, and you are focusing, and you're getting close to that patient, you can help them move into that same coherent, resonant format. And that is driven by the vagus nerve. That's what happens. Where's my dog? There she is. Hold on. Sienna, pick your head up. There you go. So when I put her on my chest and breathe with her, we are sort of getting our vagus nerves together, our parasympathetic systems in gear. So I think that there's something in this for the practitioners as well. I think that the best ones do a little ritual, do a deep breathe, to center their bodies before they go in to be with the patient, and try to stay in that sense. Now, I'll point out something else there's mindfulness for physicians, and being mindful means that you are being present. You're right there. But when you are in the healthcare realm, you also have an intention. So we actually believe more in this concept of presence and the intention to light up new possibilities in the minds and hearts of other people, of your patients. So I think if you get people into this relaxed, vagal state, you can light up new possibilities in their minds and hearts more easily.
Amazing. So as we wrap up, we'd like to thank Dr. Tager for being our guest today, as well as to MYOS MD for sponsoring today's Power Panel. Fueled by the revolutionary proprietary ingredient Fortetropin, MYOS MD is trusted by healthcare providers nationwide to deliver real results backed by science. If you'd like to learn more, you can go to myosmd.com, where we have a lot more recordings like these. We also post them on our YouTube and on our blog. And if you want to learn more about how to bring MYOS MD to your practice, you can reach out to someone on our team. All right. Well, thank you so much. How can our listeners learn about you, Dr. Tager?
So you can hit me up on Instagram at drmtager. hit me up on LinkedIn, which is a great platform. I would encourage people to look at the Vagus Nerve Society, vnsociety.org. We do have a professional clinical training program, and those are the best ways to get to me.
Alrighty. Well, thank you so much and have a good rest of the week.
You too. Take care.
Alrighty. Bye-bye.
Bye.